Hi, this is Simpe Jonas from the Center for Risk Analysis. In this video, we share some insights from a Q&A session of a recent briefing with clients. The question relates to what the implementation of the NHI bill would eventually look like. Now, the National Health Insurance Bill seeks to nationalize South Africa's private healthcare industry in terms of its funding and eventually its operations. Put broadly, the NHI bill is about standardizing the quality of healthcare across South Africa. Dr. Frans Cronje, Director of the Center for Risk Analysis, unpacks this further.
Well, the idea of NHI is to, in effect, nationalize the private healthcare industry in the country, starting with its funding and then its operations. And related to that idea is not to improve the quality of healthcare universally, but to ensure an equal quality of healthcare universally. That's what the private healthcare industry has never fully understood. So it was pointless to lobby on it by saying, but you don't have enough money to give everyone access to what we've enjoyed in the private sector, because that wasn't the intention. The intention, again, was more ideological. Good example of how ideology is not properly considered in some of the assessments drawn by some economic sectors in South Africa. Had it not been for COVID, I think the government would have advanced quite aggressively in the direction of effectively nationalizing private health contributions, forming a national fund and trying to become the key dominant supplier of healthcare services in the country. But I think, and maybe here in time I'll be accused of being too optimistic, I think the devastation triggered by the pandemic, the economic devastation, we should perhaps have a webinar on that, David, as well, because we've got some amazing numbers on the economic reversals that have been triggered by the lockdown. I think that the damage done is so severe that any attempt now to fully implement something like national health insurance or expropriation without compensation will trigger such immediate negative reactions from markets in the currency and in bonds, that it will so accelerate South Africa's economic and political decline. The devastation wrought to the economy by the lockdown is so severe that if it's followed immediately by populist ideas such as actually nationalizing private health insurance, which was on the cards, the markets, the currency may respond so negatively, so fast, and may so accelerate the political consequences of further economic decline that policymakers might actually stall on this now and move more slowly than they otherwise would. Not because they don't intend to move in that direction, ideology demands that they do, but that they better understand the consequences of it, so they try to move a little bit more slowly. So the implementation of national health insurance will look exactly like today looks. A world-class private sector with health insurers and a very poorly managed, low-quality public sector, not so much for a lack of resources, but because it is managed as an experiment in social engineering as much as an attempt to run a good public healthcare sector for the country. Also on this, David, now, we haven't got here yet, is the International Monetary Fund. Much of Mandela's move to gear, he inspired the context since that speech in Davos that Mbeki took into gear, was inspired, we're very sure, by the understanding that the Nats had so wrecked the South African economy that if the ANC did not reform, it would surrender policy sovereignty to the IMF by the end of the 1990s. Now, under Mr. Ramaphosa, that terrible result, because it's a terrible result for the ANC. I mean, what's the point of your revolution, your overthrow of apartheid, if in time you have to consult Washington on the contents of your budget speech? You're not truly in charge of your country. Now, despite the warnings that this would happen, it has been allowed to happen. It was going to happen inevitably, and under Ramaphosa, it just happened a little bit sooner because of the lockdown. Now you've got someone watching from abroad. And if you move now firmly towards expropriating a health insurance fund or anything for that matter, you will trigger responses. The ANC's ability to make policy is increasingly compromised by the fact that it has a partner in government. Now, the IMF might not be fantastic in some of the reforms it pushes, but this greatly complicates the position. And blanket expropriation of something now would make it very difficult for the IMF to proceed with further funding. But the ANC will demand further funding because it needs it if it wants to run the country effectively and stave off defeat. So it's checkmating itself time and time again on the nexus between politics, economics, and the support of people. And I think will it move fast towards expropriation? Will it move fast towards national health insurance? It was going there, but the IMF entry is going to greatly complicate the effort to do that. But also bear in mind the IMF is only contributing 70 billion rand this year. That is just on 10% of the deficit that the country faces. It's not yet a major financier, but that may change in years ahead.
If you enjoyed this video, make sure to give it a like and subscribe to our channel. To become a client of the CRA, you can follow the link in the description box below.